Before we get to the adoption agenda, I'd request that this body take a moment of silence for Danyan Gibson, who was the 16-year-old girl who died after being stabbed in Warren Fitzgerald School. She was described as being a straight-A student, a member of the high school's cross-country team, student council, robotics club, and color guard. So a moment of silence would be appreciated. Thank you very much. Number 3, adoption of agenda. We have a motion by Carabelli, support by Sauger. Please vote. Thank you very much. Number 4, approval of minutes dated September 6, 2018. Do we have a motion to approve? We have a motion by Drollet, support by Romano. Please vote. Eventually. That item passed 10-0. Number 5, public participation. Anyone in the audience wishing to speak? You have 5 minutes to address anything on the agenda. Going once, going twice, going thrice. Seeing and hearing no one, public participation is closed. Number 6, budget reviews. Community Mental Health, John Kinch, Executive Director. Mr. Kinch, or should I say today's Executive Director.
Not tomorrow.
Good afternoon, Mr. Chairman and Commissioners. Thank you very much once again for the opportunity to be able to present our budget to you for your consideration and approval. As you know, we've been working internally as a finance department here, trying to always put together the best budget together in the interest of the consumers. It was approved, received, and filed by the Macomb County Community Mental Health Board and comes before you for review. The vast majority of the budget, as you understand and know, is predicated and delivered through Medicaid dollars, state or federal funds on the Medicaid side. So our budget is, around $200 million annually, all things considered. About 95% of that money plus is Medicaid monies, federally protected monies, not only Medicaid, Healthy Michigan Plan monies, and Medicaid expansion as well. We also receive funds on a general fund contract. That contract's worth about $8 million. It's a public safety net where we deliver services for those indigent folks who have no other means to be able to pay for and be provided for emergency psychiatric crisis-like services. We have an initiative going on, a federal demonstration that's going on, state demonstration, federal monies, with integrated care organizations. So we work with 5 HMOs that are nationally recognized health maintenance organizations, where we bring in added revenue from the HMOs to integrate care. So not only physical health care, but behavioral health care as well too. So those are our 7 contracts, our 7 funding sources. And historically, we've been through some difficult times the last 3 or 4 years. On the Medicaid side and on the general fund side, lots of changes in revenue. We've been able to remain solvent. It gets increasingly hard each year to be solvent, but we have been solvent on the Medicaid and general fund side. I suspect that we'll be solvent again 2018 as we close out this year. We won't know exactly how well we close out until right around February 28th. So it takes a while to close it out. There's a lot of claims that are coming in, 30, 60, 90 days after we close after we conclude service authorization. For the role of the Board of Commissioners, I think it's pretty straightforward from my vantage point that you're statutorily obligated and required to provide matching dollars. It's about $1.9 million on the general fund side. So you're going to throw in 10% of the matching dollars. And then on Medicaid is a drawdown, and you're also statutorily required as a county to support the drawdown, and that's also about $1.9 million. So when I speak about the total $200 million, the Board of Commissioners, the county proper, has a responsibility for about $3.8 million of those drawdown and matching dollars. And Cindy can explain a little bit more of that if there's any questions. We have also put in our proposal a request for you, as you supported last year, because of the absence of general fund monies, some non-discretionary funds. I think it was around $260,000. I don't know the exact number. We're asking that again for the non-discretionary funds that we can use to help people who are coming through or otherwise have no insurance, and some ongoing aftercare services, and also the crisis center. Historically, it's been perceived as the Macomb County Crisis Center. It's the crisis center, or it's community mental health. It's a Macomb County Crisis Center. And last 2 years in a row, you've actually provided us with around $250,000 in general funds to support staffing at the crisis center to keep it operational 24/7. So we have those two requests in for you as well. I think that's the sum of it all. I'll take any questions or any comments.
All right, thank you very much. I'm sure we'll have some speakers. Can we get a motion to receive and file? We have a motion by Leonetti, support by Kraft. Commissioner Carabelli.
Thank you, Mr. Chairman. You answered a lot of questions, but I just want to recap a little bit. Did you, non-discretionary, the reserve guarantee, in the 2018 budget, you came back, I believe, after the budget was adopted by the board, and you asked for a reserve guarantee of, I want to say it was like $4 million. Does that ring a bell at all?
We may be saying the same thing. I don't typically use the term reserve guarantee, but
All right,
we could be saying the same thing.
Let me rephrase you. You didn't physically need the dollars. It had to be shown in your plan that in case something happened, you had a reserve cash that, God forbid, you needed it to take care of something.
Okay, I know what you're talking about. That Internal Services Fund, ISF, is a reserve because we are a risk-based contract. We have a shared risk with the state of Michigan. So we are supposed to have the equivalent of 7.5% of those monies on reserve in an internal services fund. So looking forward into next year, if our contract is $200 million, we won't know. We won't know till the end of the year. But if our contract is $200 million, then we should have $15 million on reserve.
Okay, so let me back up a minute. I don't believe, and I don't recall that was ever done before. It was the first time that you had asked because of the financial challenges that your community mental health was having, and you had asked the board general fund dollars to do this for the first time because you didn't have enough actual reserves, and you asked us to do a promissory note. And I don't know if anybody else recalls this. So I'm asking, that expires at the end of the 2018 budget. Are you asking for an additional promissory note from the general fund going into 2019 budget? And if Steve, if you'd like to come up, do you know what I'm talking about? Is it?
I don't remember the commission asking the general fund to put money into that internal service fund or risk corridor fund or whatever you might want to call it.
We didn't transfer it, but we said, yes, you can use our dollars out of the general fund.
As far as to my knowledge, the only transfer money is being provided from the general fund to mental health are for our match requirements plus a few of the discretionary dollars that Mr. Kinch referred to.
So there's no more.
There's no transfer.
Okay, so we're not using our bond rating or whatever you want to call it. We're not taking money and guaranteeing if they fall out short in their budget. Because that was asked the last budget cycle. You guys came to us and asked us for that. Does anybody else recall this?
Point of information, I do recall him saying he may need to do that, and then he worked on going up to Lansing, correct me if I'm wrong, to straighten out a lot of that mess.
Okay. All right, so maybe I was wrong.
Commissioner Carabelli, I remember bits and pieces of it, but details of it are sparse at best.
Okay, no problem. Thank you for that. The next, and you said the 1.9, the drawdown, and then 1.9 for the general fund, the matching it. I appreciate that. Makes sense to me.
Okay.
What I do have to ask you, budget amendments that you do at Community Mental Health. So you guys decide to close a building, buy a building, whatever it is. If it's outside of your budget and you have to make an amendment, does that come back to the Board of Commissioners?
I don't believe we've ever brought an amendment back to the Board of Commissioners. I mean, we're not going to purchase something outside our budget.
Okay, the reason why I
but-
ask that, there are rules that anything that falls within a percentage in dollars, that has to come back to the Board of Commissioners.
Yep.
The reason I asked that, I heard that there was a facility, and I don't know the name of the hospital you guys had, and it wasn't doing well, and you decided to close it down.
Yep.
And you guys are doing the management over there, and I'm not here to micromanage, but does that impact your budget? Do we own the building? Do we lease the building? Is there a contract that we got out of? Because that goes to the executive's office, and then comes for ratification up or down to the Board of Commissioners. And I don't see the Board of Commissioners in this cycle, and I'm really confused because we have an ordinance here that has to be followed by all. And I'm asking, unless somebody else here on the board can tell me, I have not seen this stuff come back in front of the Board of Commissioners.
Let me go back to that. We acquired a property through a lease, a 5-year lease, for our urgent behavioral health care clinic on Garfield, right across from the MISD. We acquired that property about 3 years ago. We developed it and built that building out with the support of the landlord, and entered into a lease. And the way we typically do it, Mr. Carabelli, is Macomb County Corporation Council reviews the lease agreement in advance. They make sure that it's up to snuff legally, and then once they approve the lease agreement, then we typically go to the Community Mental Health Board for approval of the lease. And then once it's approved by the Community Mental Health Board, it's signed off by myself, the landlord, and the county exec's office. And probably very true, it doesn't come back before this board, nor have our leases in the past, from my understanding, come back before this board. So we have about 120 group homes that are all leased. They don't come before this board, but they appear generally routinely on the budget for the Community Mental Health Board. And then we have probably 6, 7, 8 other properties that we lease throughout the county with various landlords.
So those 120 or more, the executive signs off on every one of those?
The executive signs off on everything I sign off on every contract, yeah.
So I guess, Crystal, when you have the opportunity, because I believe community mental health does fall under the ordinance here at the county, and I believe that this stuff has to go back through, number one, if it's an adjustment to the budget, but any contracts have to go through the county executive, and then they go through final approval.
Yeah, I believe that mental health has been specifically exempted from the contracting policy,
And that's where we have to just do some verification to see
which kind of
that.
flows through to the budget ordinance and everything else.
So do they have to come back after their budget's approved to make any budget
No.
ordinance? They don't even
Our
have to make,
interpretation is they've been exempted from purchasing policy, contracting policy, budget process, everything. Because they have their executive board that approves all
and where's that, where can I find that?
The exemption from the contracting policy, I believe, if I remember correctly, is in the contracting policy.
Okay. All right, thank you, Mr. Chairman.
You're welcome. Steve, would it be possible to get a copy of that, or I'd like to get a copy of that and get it disseminated to all the commissioners,
Yeah. I mean,
so that we're all
yeah.
on the same page.
Yeah, you should have it in your office.
Okay, fair enough. I'd still like it disseminated to everybody. All right, any other, Commissioner Kleinfeld?
Okay, I understood when you said the leases and purchasing, but you indicated as well amendments to the budget do not come back before us, is that correct?
I honestly don't recall bringing an amendment back to you, no.
But if amendments don't come back to us, how do we have any responsibility on this budget at all?
I guess I would, kindly ask you to describe for me, unless Cindy wants to take over here, what types of amendment, because the budget is, fluid, and, it's an enterprise budget, as we know, and so we don't know our revenues for 2018 or our expenses till 2018 until February of 2019. We won't know what our total revenues are based on enrollments and eligibility and fund sources in the state anymore. They don't give you your monies up front. They give
Okay,
you-
and I don't need to be specific on amendments, because I just mean generally speaking, if you don't know all of that, and when you do know stuff, it doesn't come back to us, while it may not have been an issue in the past, I'm just looking towards, I think, what is it, you have under a 5% fund balance, and there's all kinds of questions about revenue stream. Why do we even vote on your budget? I mean, why do we even give any stamp of approval if once we do, anything can happen with this budget and it doesn't come back to us? Does anybody else understand what I'm asking?
Well, I think it's statutorily required in the mental health code that the county has to approve of the budget. So that's the short answer.
But then once we approve of it,
The community mental health board takes over and manages it on a day-to-day basis. And any issues they have comes back, that need our address, comes back to Phil Kraft, to the board, and other members of the representatives.
Thank you, Commissioner Brown.
You're welcome.
right, but that doesn't mean anything. That means we put our stamp of approval on a budget, and once it leaves here, then anything can happen. So that's kind of a strange setup. I've always been confused about our relationship with community mental health anyway, still not completely clear about the role between us and the board. Now, just very
this is
quickly,
very good.
the 170 in the 18 to the 180 million in 19, is that 10 million that the legislature committed? It's under revenues. The revenues went up by 10 million. Was that, it says charges for services, but wasn't there something about a commitment of 10 million from the state?
The differential, I'll let Cindy speak to it, really is related to autism. We received about a $15 million additional funds for autism services because we went from a fee-for-service to a capitation on our autism services, and so we're doing a large abundance, I guess I can say, of delivery of services to hundreds and hundreds of families with children with serious or with autism disorders. And so not only did we receive 13, 14, $15 million additional this year, we're also going to expend those same monies on autism. Maybe you want to speak to that?
Actually, in addition to that, it's the whole capitation contract, if I can speak to. Basically, each month we get a revenue file, and it's based on the eligibles. So we really don't know that until after the fact. For example, we don't have our September total revenue number until next month.
But was there something about $10 million?
There was an original ask that went, and I believe the total we were actually originally going for was 12, and that's where we received a portion last year, and it was a 5 million, but that came in, that was actually rolled in as, it was a type of a grant, I guess you could say. Like this year, we're expecting $1 million grant. That was just to the tune of 5 million, though, for last fiscal year.
Okay, well, the reason I'm asking is, so if intergovernmental, that's the money from the state? I know we had money cut, and I'm looking at this budget, and I'm not understanding where was that money cut, and where was the money that was like re-promised to be put back in?
What I can speak to on that, as far as the money cut, our rates were cut. We had a 3-phase revenue reduction by our rates, our Medicaid rates. But again, the total monthly, it will vary depending on what that rate is per those eligibles that come in the various Medicaid programs.
In the budget, because that's what we're doing here, it's a budget session.
Right.
In this budget, where are the cuts on the line items that we've been facing?
I was just saying the total revenue, as far as, again, when we put that budget together, how many months before? And again, we didn't have even information as to what dollar amount, what you're asking for from the state. We didn't have that at the time of that budget.
All right, I don't understand any more than I did when I started asking
All right,
questions.
okay.
I might need somebody to tutor me, thank you.
Well, okay, do you have a copy of page E6 in front of you?
We do.
Okay. Here you go. Explain how we went from 217 million total revenues to 218, 180. That's $37 million. Where'd $37 million go? That might be able to,
I was talking about from 18 to 19. I wasn't talking about way back then.
okay, go from 217 million to 190 million.
Oh, okay. I see it from 16 through
19.
217 million in 2016 was the actual,
Yeah,
and then the recommended budget is for 2019, 190 million, right?
right,
So your question is, where's the $37 million?
correct.
Well,
That might go a long way on explaining some of this.
you know, I've described and informed the board before, we reduced services
Right.
to the community. We tightened up our utilization management practices, still delivered services based on medical necessity, but we literally cut millions of units of services that typically go to families for helping them care for their adults and their children. We have 80 vacant staff positions right now. My staff was 520. I'm around 440. I have 80 vacant administrative and union staff. All of our providers, we have world-class providers. You always hear me say that. Henry Ford's, the McLaren's, the St. John's, Hope Network. We're in a 2019 marketplace. Their rates are frozen at 2015 rates. We have, voluntary furlough. We have a lot of other chump change kind of ways to picking up revenue, but the majority of it is in the reduction of services to the consumers, which far and away was the hardest hit for them as they realized that, reduction in staffing, and then the rates that are frozen at 2015 rates. And that'll carry forward. That'll carry forward for another few years.
All
I
right.
don't think anybody gets the levity and the how much when we lost that $35 million and then when it was reappropriated through other parts of the state, how damning that really is on our community. And it'll play itself out for years.
All right, thank you. Hopefully that explains some of it. Commissioner Leonetti.
Thank you, Mr. Chair. Good to see you, John. I just have a question based on something you just said. So you are down about 80 employees. When did that occur? Because I'm looking at your 16 actual budget, and it was this is for full-time wages, $15,676,000. And for 19, you're actually up a little bit. You're at $16,007,000. When did you downsize the 80 employees, or when did that happen?
It's been through attrition over the last 2-3 years, probably 3 years in running.
Okay.
It's in a combination. When I speak about FTEs, we have around, I don't know exactly, 346 and a half employees of the county proper, salaried employees, and we have about 150 that are through a staffing agency.
Okay.
And so maybe better put in positions. So, someone staying in trust with the AFSCME agreement, the HRLR, Human Resources Labor Relations Agreement that we have with AFSCME. We prefer an AFSCME employee, but an AFSCME employee is 3 times more expensive than someone in America's back office. So when positions become vacant through attrition is when we refill some and don't refill the others. But why the numbers appear more when we actually have 80 less vacant positions, I'd have to dig a little deeper and find out that for you.
I'd like to find that out if you could, John, just a little bit. If you're down 80, then full-time wages shouldn't go up. They should really go down, especially from 16 before we had the problems with the state. So that's question number one. Question number two.
Can I
go ahead,
interrupt?
yeah.
Other than there have been salary increases.
Well, sure, that's
You know,
understandable.
so if,
yeah.
if I don't know, $16 million on a 1% or,
That's fine. I mean, going from 15,676 to 16 million in 3 years, I get the salary increases there. But what I don't get is the drop in 80 personnel. I'd assume that 15 million would have gone down significantly. So,
Just a quick point of information, look at contract services.
well, that's going to be my next question.
Oh.
Okay, so my next question, and Steve, pay attention to this question too. And okay, so I want to talk about the lease that you had that Commissioner Kleinfeld had talked about. Where we, and even Carabelli, where we didn't get a chance to affirm this lease. Is that, Steve? Does that go under contract services? Is that lease? I don't see a lease here. You know what I mean? Would that be something that would have come under the budget for contract services? And again, this is an issue like, an IFAS issue. I don't know what contract services entails, but it's a lot of money. It's $154 million being recommended.
Yeah, I believe the lease agreements are under supplies and services, not contract services. So
Okay, so
contract service is going to be most of their contract labor.
Okay, that's what I wanted to know then. So supplies and services would be the actual physical lease for the building. And then what John was talking about, when we had to take some employees out of full-time wages, we would then contract out employees, I guess, and that would fall under contract services. Is that kind of what it sounds like?
That I'm not exactly sure, but let me comment on what I think might be going on in the salary line item, as Matt can confirm me or one way or the other. So what you see in 16 and 17 are actual numbers.
Yep.
So I believe, much like we put a turnover factor in the general fund, I believe mental health also puts a turnover factor into their budget for their county, their full-time employees. So what you'll see is, if they have a consistent number of vacancies from year to year, the actuals in the 2 prior years will more closely match the budget if they're budgeting for those vacancies.
Gotcha. Okay, so if they're budgeting
Much
for it.
larger turnover. I mean,
Right.
80 out of 350 is, we put 5% in. And they budgeted that way for as long as I can remember. In
Yeah.
terms of having a turnover factor, they've always typically run a fairly large number of double-digit vacancies.
Well, okay, and I understand that, but it seems to me that we should see a dip then. In other words, I understand you're budgeting for the hope that you have those positions, but those positions aren't there. So where's that money going, I guess? You know what I'm saying? I mean, it's a fair question.
Yeah, we reduced, so the head counts in the budget, much like we did the child care fund.
Okay.
So in the child care fund, we budget for occupancy of about 100 kids. We're running 40 or 50. They typically spend about 73% of their salary budget. So we reduced the budget for all the employees at full capacity by 20%.
Okay.
So you'll see the budget is less than it was in the prior year. Here,
It's up. But
it's
going
up,
up.
but again, calculate all the salaries as if all positions were filled. You throw in a vacancy factor of whatever mental health is determined is appropriate for their agency, and you get your full-time wage
Okay.
number. Now, you also increase the wages by 1%,
Yeah, we
et
get
cetera,
all
whatever
that, yeah.
contractually we're bound to do, and you get your budgeted number, assuming a certain number of vacancies. If that number is close to what has actually been
In the
realized in past years, that's why you see more of a linear,
Okay.
and you don't see a
So,
drop.
in other words, what you're saying, if we had those 80 full-time employees, then, well, this still doesn't make sense to me. You're saying the budget should maybe be, say, $20 million.
If every position was full, the salary budget would be much larger than it is. And
Okay.
then the
Okay.
revenues in theory would be larger, and,
All right, I got that. Okay, I think
or
I
you
got
have
that.
a reduction in outside labor costs or contractual labor costs.
That's my last question. You might want to stay up on that. This contract services, the biggest part of this budget, $144 million. What does that entail? So I know now it doesn't entail a lease, but
I
does
think
this,
it's mostly contract labor, if I'm not mistaken.
John?
Community mental health is not about administration, it's about supports and services.
And
So-
no question. So there's different agencies out there that this is where that money would go to, if I
Yeah.
understand
We
correctly.
probably have 350 agencies.
Okay.
Someone needs acute psych inpatient, we pay Henry Ford.
And I get that. I guess what I wanted to know is, and this stems all from the employment, how much of this is going to agencies that are helping our mentally challenged folks, and how much of it is going to somebody's salary? Because again, I don't know the difference between contract services and wages, and that's a fair question.
You know, that's one of the things that really gets everybody's attention. You know, how many layers of administration? So if you know, there's a layer of administration here using Medicaid dollars. You know, half of my salary or half of my household income is paid for by Medicaid. You know, my wife takes care of the other half of it. You know, so I'm really a Medicaid recipient, is what I describe for my folks. And now I contract with MORC. Well, they have a whole administrative line as well too. And MORC, Macomb Local and Regional Center, they subcontract with some specialized services program, and they have a layer of administration that gets a lot of scrutiny
Yes.
rightfully so from you, from the state of Michigan, from everybody. There's too many layers of administration. Let's cut right to the chase and, you know, get the dollar to the consumer.
And that's generally kind of where I'm going with the questions. And I understand this is not, you wouldn't be doing this for free. You know, I mean, there has to be levels of administration. I get that. I guess I just want to know, out of these contract services, you know, maybe we can get a more detailed thing through IFAS or something like that, is, you know, what is going to actual services, what's going to our contract employees. That much I think we can answer. The rest of it, once you give it over to, say, somebody like the Arc of Macomb or something like that, they handle it from there on down. I get that. But I want to know, that's fine. If I see so much is going to the Arc or so much is going to this one of these 350 agencies, that's fine. How much of this is distinguished from, say, our contract employees of some sort? That's what I'd really like to know.
I think we direct operate, when I say that, through salaried AFSCME employees and through America's Back Office that we use as a staffing agency. I would say about 20% of all of our cost are direct operated, and
Okay.
the rest of it's contracted out. It's
Okay.
a rough number, but I've always used 20%, so I think that would ring true.
Okay. All right. Thank you. Thank you. Thank you, Mr. Chair.
Thank you, Commissioner. I've got Carabelli, Lucido, and Kraft. Hopefully Commissioner Carabelli can wait for the second round. Commissioner Lucido.
You know what, you answered my question.
I did? Thank you. Wow. Commissioner Kraft.
Thank you, Mr. Chair. This question is for Cindy, possibly Steve. The ISF funds, where does that show up in the county's budget page? Is that a intergovernmental revenue every year? What line item does that fall under for our purposes here?
Actually, as far as that, it is a portion of our revenue, so I can get back to you with more specific information. But as far as how it's reported on our financial statement to the state, it is part of our revenue. So as John mentioned, that 7.5, that's again a portion of that revenue. It's just something that we have to take a portion to kind of tuck away as far as that savings for risk.
Okay, I was just wondering if that actually showed up on the budget page for this, or if it was just something that, you know, we have at CMH that goes to the state, or how that all worked, because
Right.
that's another, it's sort of added dollars, but it's not.
It's not added, right, it's a part of that.
Okay, thank you. Thank you, Mr. Chair.
Thank you. Commissioner Carabelli, second round.
Thank you, Mr. Chair. Two quick things. Your anticipated cuts, did you state from 2018 going into 19? Do you know what those are yet, that the state's cutting?
We're doing an analysis right now. We received our rates about 2 weeks ago, and it takes an awful lot of effort working with an outside agent to create pivot tables and a number of different things. You know, our rates are, I say this a lot, and it's really, we just don't get a check for $180 million. You know, a child from 6 to 12 years old, we receive, you know, a figure with,
Okay,
you know,
let me-
8 or 9 decimal points.
Yeah, you're right, and let me back that up. I
don't
don't
know
need that
yet.
deep. My thing is that if you're receiving X amount of dollars in 17, you're receiving X amount of dollars, you had a cut. I don't need which department or where you're cutting it, but so if I have a pot and you're taking a quarter of it out, and then move to the next year, you're taking another piece of it out. 2018 and 19, what's the difference in the overall dollar?
We'll know that by October 3rd, and we'll report it out to the board on
Well,
October
there's
3rd.
anticipated cuts that I've read in the paper and I've seen from the lobbyists and a lot of other things. You don't have a clue of what you're getting?
I think it's going to, no, I think the cuts that have come to us have already been borne to us. I
you
believe
think-
our revenues for 19 will be comparison to 18.
Okay. Then the last thing is, I believe Steve was correct when he talked about the contracting ordinance about coming back. But make it really clear, the appropriations ordinance, you do have to follow. There's nothing in there that says that you do not have to follow the ordinance. So Steve, I challenge you and John to go back and take a look and get back to the board and figure out how we're gonna address this. Well, I'm reading it right here. So you can pull it up and look at it.
State statutes.
Well, there's a.
Okay,
This is a different
Okay,
gentlemen, commissioners all, we can discuss that at a later time, and I'll make sure that we get it down. I don't want to get into this, he said, she said, they said, we said at this point of time. We've got enough of that all over the place. Any other comments? Commissioner Carabelli? Commissioner Brown? Any other comments? We have a motion and support to forward this to receive and file. All in favor, please vote.
Thank you so much.
And Director Kinch, how much more time have you got left?
You want to know the exact number of days, hours, and minutes? I can tell
Yes, exactly.
you. January 4th, I'm working with the board on succession planning, and I'm optimistic and really looking forward to the new CEO they bring in. It's going to be a great time.
From myself, I want to thank you for all your work, your passion for CMH and for your position has been actually pretty astounding. Hopefully we can answer all the questions that have been brought up here. I will see you before that, but I wish you good luck in your retirement.
Thank you, and we appreciate the partnership we have with the Board of Commissioners, too.
Thank you very much. Before we get to community mental health, substance abuse, Martha T. Berry monthly report, Director Evans had previous engagement that he had to go to, so number 7 presentations will be presented the next meeting we have. That being said, 6B, Community Mental Health Substance Abuse, Randy O'Brien, Director, Office of Substance Abuse. Good afternoon, sir.
Good afternoon. I have with me Kathleen, who's Parzinski, who's our finance coordinator in the SUD department.
Good afternoon and welcome.
Good. Thanks. Hopefully ours is a little simpler than what you just went through, but
Hopefully.
I can never predict anyways. But we're really, we only have, on the SUD side, we're our division of community mental health, but we do a lot of things separately and a lot of things together, but our budget tends to be separate. It comes in and out from a different source. Some of it is same division, or not same department, but different divisions. So I think that's partly why we report separately, although substance abuse, especially these days, is kind of a different beast. We have two ways of funding that we seek from you. One is the discretionary funding, which is that we get from you each year. We're asking for $142,950. Which basically we only come to ask you for those monies when our administrative costs have gone up. And this year they went down in our planning, so we're reducing that as well. We also have the non-discretionary money, which is the larger share of it, which is PA $2, which comes as a result of the increased liquor taxes from Cobo Hall. You'll see in my letter to you that we are budgeting over $5,329,000,000 for this year. That money, we really have little say over it. What we can do is, because that money only goes to licensed substance abuse treatment and prevention programs. So we don't get that for administrative costs. We can't use it for any other purposes other than for that. If you look into our biggest problem this year, last year, the year before, has been the growing opioid problem that's occurred in this county. It's occurring in the state, and it's occurring at the federal level as well. We've seen a tremendous increase in the number of people that are overdosing due to initially was about 4 or 5 years ago was primarily heroin. This year or 2 years ago it was opioid prescription drugs, and now we've seen a drop in that. And now what we're getting is fentanyl, which has been used in surgery, but fentanyl is getting laced into just about all of the drugs out there. I mean, they don't discriminate in where they go. It's a very lethal opioid, and it is also, well, it is what it is, I guess. But so what we're doing is, I don't know if you've read the paper, but last year in 2017, the medical examiner just published his report for 2017, the opioid deaths, and over 380 people died from drug overdoses last year, and out of that, 200 of them, or over 50%, were related to fentanyl. And they're doing fentanyl now. They're even lacing it with it's illegal manufactured over in China. It finds its way here, and it also leaves it leaves a lot of people dead. So, anyways. So that's what we're spending the bulk of our money at. Last year we received almost $2 million in extra dollars that came down from the feds that also had to do with trying to reduce the level of opioid activity and drug overdose. We were able to establish a number of new initiatives. We had 9 new initiatives where we were there, some of which have been very effective already. And some of which have still yet to kind of develop to get to that point. But we've got, probably the biggest one that we've had right now is one in which we've got peer recovery coaches that are going into the emergency rooms at the hospital, the three hospitals that we have in Macomb County. Well, there's still another one. But we have St. John, Henry Ford, and McLaren Hospital is the latest one to hook on. You get recovery coaches go in the emergency room and they help. They work with people there. They've already been through addiction and they're on the other side. They all have 4 years or more of recovery, and they do and they help to hook up treatment or some other way of support. So. That's been a very promising one. I don't know if you want me to go through this. This is a finance meeting, so yeah.
Thank you.
Okay.
That being said, the chair needs a motion to receive and file. You have a motion by Kraft, support by Drollet. On the list, we have Commissioner Lucido.
Hi, thanks for coming.
Thank
You were
you.
actually talking about what I was going to ask, which was, what are you doing to fight the opiate? And you had talked about 9 initiatives.
Yeah.
I mean, you don't have to go through every single one of them, but if we could have just maybe a copy for ourselves later, just to give us
Sure,
an idea
sure.
to
I
share with the public when they're asking
yeah.
that question.
Yeah.
Okay.
Okay, I won't go through it. You don't want me to go through it now?
You don't have to go through them, but if you
Okay,
could
I
provide
can
us
provide
with that.
you with a listing, a detailed listing on that, yeah.
Okay,
We've been
thank you.
doing a lot with that, and just generally speaking, we have been able to really increase our system of care, that our capacity to provide services and treatment services, we've almost doubled in the last 5 years. So we would not be able to tackle this thing at all if we were not in a position of doing that. So, and that's a lot because Healthy Michigan had a big impact on that. We were getting more Medicaid than we were. We're kind of in a different boat than we're on the mental health side. But we've got more resources now to do it. And anyway, so I'll include that in the
Okay,
letter.
thank you.
All right, thank you. Commissioner Drollet.
Thank you, Mr. Chair, and thank you for your participation today, your presentation, rather. Of the 9 programs that you summarized somewhat, dealing with opioid addiction and helping deal with that crisis, what are some of the, do you cooperate with some of the other agencies involved in Macomb County in dealing with the opioid crisis? And to what, I guess I remember we just recently had the MSU Extension, for example, come forward and say they're doing a lot of work on the opioid issue as well. To what extent do you work with MSU Extension? How many of your programs interact with them, that sort of thing?
Well, first off, we don't provide services in our office.
Okay.
That's all contracted out. So all of these services that are being provided are done by licensed treatment and prevention agencies.
Okay.
So we are always working with the agencies, and the agencies are working with other agencies as part of that. Specifically, I can't speak to MSU at this point, but we are encouraging that, like MSU is also is affiliated with some of our local coalitions that are done on the prevention side, so that they would be part of that, and they've got their own efforts that are not necessarily specific to these 9 initiatives,
Okay.
but to regular SUD prevention themselves. So we try to encourage it, and we're also part of a Operation RX is what we call ourselves, which is kind of a county-wide coalition of different agencies that are coming together to try and come up with strategies for reducing the opioid problem. So we've got people that we have FAN involved. We have CARE of Southeast Macomb. We've got Henry Ford Hospital in that group. We have our group. We've got several other groups, and we're looking to expand the leadership of that as well.
So how many people are involved in those groups? How many groups are involved in that?
Well, that one
coalition?
we have, I believe there are 9 different subgroups.
Okay.
And they're all dealing with specific areas, targeted areas like Medicaid or physician education. Some of them will be substance abuse education. Some of them are in the legal area. We did have one for working with elected officials. That one's not very active right now.
There's probably not much hope with those, but
Yeah.
So is MSU Extension a major participant in any of those particular subgroups?
If they're on the subcommittees, I'm not familiar with all of the subcommittees,
Right.
so I don't know. We're at the at kind of the organizational level, but I'm not aware of. But I can look. I can find out where they are.
Okay.
But we've been having some reorganization meetings in the last 6 months. We're trying to find ways to expand it because it's the kind of thing that we think everybody should be involved in. Everybody should be involved in if we're really going to have an impact on this. Because all the time and effort and money that we spent toward it, you still got people dying. So
Of course. Okay, thank you very much.
I'll get you something.
Thank you, Commissioner. Commissioner Kleinfeld.
Thank you. Just in general terms, your fund balance is predicted to drop by 2.2 million, and then in 2020, 2.4, and 2021, 2.4. So your fund balance is going to drop from 9.4 million to 4.5 in a span of a couple years. How are you going to deal with that? Are you looking, would it be something where you would have to cut your contract services because that's where you do most of your?
Yeah, I think we're safe, but I'm going to let Kathleen answer that one. She
Doesn't
works
look too
closer with the
safe from
numbers.
this perspective.
Even though we're projecting that we're going to be using our fund balance, the way it actually works is we use our block grant dollars first. So like during this past year, fiscal 17-18, we were given these additional grants for the state opiate crisis and the innovative strategies. So we utilize those funds first before we actually use any of the PA2 dollars, and then our fund balance. So while it looks like we're continuing having a decrease, our fund balance will still be maintained at probably around 9 million.
So you really have to put this in here because you don't yet know what those are, the promises and everything. So you're just
Exactly.
giving us, like, this is worst case scenario.
Right, we look
Okay.
at when we're doing the budget, we're looking at all the programs and all of our different providers and what we want them to offer, and we budget based on that. And
Okay.
then, of course, then it's like, okay, well, we estimate we're gonna get so much in block grant dollars. Now, like the new programs that they started, the SOT, it's like alphabet soup, state opiate thing, it's a new one that they're coming out with, and it's about a $720,000 grant. That's not included in the
Okay.
budget because I didn't even have any idea what the amounts would be.
Okay, thank you.
Thank you. Commissioner Leonetti.
Thank you, Mr. Chair. You have E12 in front of you, right? The budget page?
E12. Oh, that's it. Hope that wasn't it.
Okay.
So under contract services, in 2018, it was about 16.5 million. It's going up $2 million, at least the recommendation for 2019. It's going up to almost $2,200,000. What's the significance for the increase in that?
Again, a lot of that is due to these additional programs that we have started. And
The
that
9
we're going
initiatives?
on.
The 9
Right.
initiatives?
The
Okay.
SDR, the State Targeted Response Programs, which were started this year, but then they'll be continued on through next year. Even though the grant ends like May, we're still going to be funding it, so we're going to continue these programs. The Innovative Strategies Program, which ends actually September 30th, we're maintaining these programs, so these are all part of our providers. So
Okay.
our contracted services is primarily, I'd say roughly 95% is due to our providers.
And give me an example of a provider. Who's like a provider?
Macomb Family Services, Quality Behavior Health, Biomed, Care, Sacred Heart, that's a big one, CPI, Community Programs, Clinton Counseling.
Okay. Is there any chance, it's great that we're going to continue with the providers and the programs and the initiatives. It's a $2 million increase. Is there any hope that we're going to get more grants, given that the opioid crisis is such a big deal? I mean, do we expect to get any more grants? Because when you look at the overall budget here, in the previous years, one year you were over by 1.3. The next year it was, 2 years later it was 3.5. We're looking at being over budget here by $5.5 million. I mean, that's a lot.
Well, we do know we have the new grant, which is not incorporated in the budget at all as
Okay.
revenue for.
How much will that be, that new grant?
Approximately $720,000.
Okay.
And that's the only one I know of
You
at
know of,
this
so there's
point.
more out there.
Right, it is a 2-year grant.
So it's really 365 for this year and 365 for next year.
And I don't know how the state's going to break it up.
Right.
I mean, we just got the first memo saying that it's coming out.
Given the nature of the opioid crisis, does your department have like a person that looks for grants? I mean, do you have anybody actively looking for grants that are out there? I mean, that's a question we're asking all departments now.
It's Randy.
Yeah, yeah.
Quite honestly, we don't have to look for grants right now. They're falling into our laps.
Okay, well, that's a good thing.
And what we get now for $2 million, I mean, what that's said for what we spend, we're allowed to carry it forward if it's not just a state decision, but it's a federal decision too. Mm-hmm. So we've got probably an extra 6 months onto this. Right now, quite honestly, we have enough money in our PA2 dollars to be able to absorb those cuts. And it's our intent so that we've got, as Kathleen said, we've got some of the programs will be ending in mid-year. And we built into this budget that we would continue those through the years. And that's, after this year, then we're going to determine whether or not they're doing well for us or not. We'll we'll evaluate them, and then we'll decide whether or not we're going to continue.
Is that why I forecast that you have it going down a little bit? I mean, is that what you're?
Yeah.
Okay. You're saying that you're going to look at these 9 programs. Maybe we go a little bit over budget to try to see which one of these programs work.
Yeah.
And then scale back.
Yeah, but I think what you're going to see is we're going to finish them through the fiscal year. Because a lot, quite honestly, part of the problem we had with the federal dollars that came down, they came down in the mid-year. Mm-hmm. So it's in the middle of a fiscal cycle. And then what they did is you'd have to close out in September the first year, and then they would start in the second year, and then you had to close out in the second, in mid-year in the second year. So you actually end up with 3 different closeouts, for actually 4 when you look at the end of next year. Trying to manage that money as it came in was very difficult. The state, just for the state for this grant, for the SDR, which was a state target response dollars, the state allocated $16 million out to the PIHPs like us. Out of that, in the first year, they only spent 4 of that 16. So a lot of it had to do with how the money came out, how it was rolled forward. The state held up a lot of it because there was a lot of work that was tied into trainings, and that they were 6 months behind on that. So that sort of thing. So I mean, it all kinds of affects where it comes out in the end.
Okay. Is there any way to, like, maybe maybe put this burden on you, and we'll talk, possibly come in and give us reports on how those 9 initiatives are doing? Is there any, I mean, to be frank, I've not met you yet. You know what I mean? I've been on here now 2 years, and I haven't really, I haven't seen you folks a lot. I haven't seen budget amendments that come in and say, hey, we received some federal dollars. We're going to amend the budget so that, our revenue is up. I haven't seen you, which means you're probably busy doing good stuff. But on the other hand, I mean, when I see it's $5 million, over budget, I'd like to see some, especially with the way the opiate crisis is now, like you said, especially with things falling in your laps. I should see you more. We should all see you more by coming in and saying, hey, we got a budget amendment. We got to do a quick budget amendment. We got an extra $500,000 from the feds, extra $200,000 from the state, whatever. I haven't seen that. I haven't seen you once this year. I'm not blaming you for that. No. I'm just saying, I want to see that we can bring that gap down. It's just over. It's a lot over budget.
Yeah, I just wanted to address the fact about the budget amendment. I mean, we haven't done any in the last year, actually. We haven't done any in the last couple years. And a big part of that is because when the state allocates us our funds through block grant, they have been constantly changing it. They'll send us a letter, then we have to resend them the form showing how we're allocating the budget dollars. Then they turn around and it's like, nope, we're giving you something different. It has been so fluid that we would never make it through the whole process before things haven't changed, because obviously we would have to take it to our board. Now, we do keep our own board abreast of all of the changes, so they do know of them on a monthly basis.
Your board being community mental health, which?
Well, actually, both. We have an SUD board,
Okay.
overhead policy board, too.
Okay. All right. Well, hopefully we'll see more of you in the next year. All right. All right. Thank you.
All
Thank
right,
you, Mr.
Commissioner
Chair.
Romano.
Thank you, Mr. Chair. Hi, Mr. Director. With all this money we're spending, and I've seen some of these notations that you gave us, 380 people died from overdose, 200 were from opioids. I don't know if that was intentional or how many of those were actually accidental, but there was 200 of them. So, and you have your 9 initiatives for reducing, hopefully reducing these deaths from opioids. I guess my treatment is kind of generic. Like, how many people that have received treatment are repeaters, recidivism? I mean, we keep dumping this money into them. I mean, it looks to me, and it's just my personal interpretation, we're throwing good money after bad. I mean, do we have reports that show how many people that we put in the recovery program are actually recovered? Or are we repeating these people 3, 4, 5 times at a crack? That's what I'd like to know. You're up.
Okay. I don't have a number for you.
Can you get it?
I can do the best that I can to get you the numbers.
The repeaters?
The repeaters, yes, we can do that, because we can usually find the high flyers on those things, the frequent flyers, as we call them.
And the accidentals compared to the intentionals?
Yeah. Well, the intentional, as in suicide, you mean?
Whatever it is, you've got 200 people that have died from opioid overdoses. I'd like to know how many of those were actually accidental, or the ones that were intentional. Some of them just like to do it.
I can't get you that information. The best they can get that is from the ME's office. They're the ones that take a close look at all the people that have died. So I can't get that, but, you can from him, probably.
Okay, and again, I think somebody mentioned this 9 initiatives. I'd like to see the money that we're putting out there, what good is it doing? And again, if it's helping, let's do it. Let's get the money out there. And if it's not, I'm sorry, I'm one of them harsh people. Thank you.
Okay, thank you.
Thank you. While you're still here and while Mr. Kinch is still here, I've got an article here from the Rochester Post dated September 13th. It's about a 72-year-old man found dead, heroin suspected. This man was in a senior housing nursing facility. I don't know how a 72-year-old gets heroin in a hospital. This did not happen in Macomb County, but it happened close enough. And this not only makes me sick, but it makes me extremely upset. This is the world that we find ourselves in, and the world that you find yourselves in. After everything's said and done, we can talk about opioids, we can talk about all this other stuff all we want. But when a 72-year-old man in a nursing home ODs on heroin, something is radically wrong. And we're not doing anything properly. I'm bringing this to your attention, and I wanted to bring it to the attention of this board. This is the world we find ourselves in. And I want to see you and everybody involved with your department do everything possible so I don't have to read this happening in Macomb County. Thank you. We have a motion and we have support. Please vote. And thank you very much for being here. 6C, Department of Human Services.
Good afternoon, Commissioners. The particular budget you're looking at for the, that's,
Come on, guys, get it together.
so the Department of Human Services budget in the general fund, very small budget. It's about $60,000. We're reducing that about $12,000 or $13,000. What's going on? There's two pieces of, two activities in there. There's an administration activity, which is paying the per diem for the meetings of the County Social Services Board, which we're statutorily obligated to pay. There's a membership in there for the County Social Services Board. There's an association of county social service boards. So roughly half of that, $11,000, is for the membership. And then there's the county emergency line item, which is $48,000, which is for applications that the state DHS makes to this county for services or to provide money for services that folks don't otherwise qualify for at the state level. It's been roughly the same for a number of years. You can see we've cut the budget in the administration because we're spending about $11,000 a year, and we haven't spent the $6,000 that was in county foster care for a number of years, so we reduced the budget to zero for that. So really, that's pretty much all that's going on in there.
Reduction's good.
All right. We have some speakers. Do I have a motion to receive and file? We have a motion by Lucido, support by Romano. Commissioner Caravelli.
Real quick, who runs this department?
It's really statutorily, I mean, the bills come to my office for the per diems. So it's really the Department of Human Services, but we're statutorily required to pay the per diems for the County Social Services Board. So those requests come through my office. If, in fact, they'll also submit requests
So
or
in
bills.
other words, there is nobody other than you paying the bills?
Right.
And
I guess at the end of the day, it'd be the
I'm
exec's
asking,
office.
is this the same thing that I've seen on TV, that there's a problem with the state with this whole scenario? Some incidents with the employees, with, anybody else read the article on?
I don't know which TV station you watch.
No, I'm talking about, they're calling the governor out and, health and, yeah, it's this department, of human services, where they go check the well checks on the, homes, is that the same? Is it the well checks, they go to do the well checks, or they
No,
go to?
no.
they
My
go to-
understanding, so folks go to the local DHS office, ask for state support for whatever.
This has
Put in-
nothing to do
and this has
though-
nothing to do with, I think you might be talking about child protective
Yes.
services? No, that's nothing to do with that.
They have nothing to do with it?
Nothing with
Okay,
that.
thank you, Mr. Chair.
Thank you. Any other comments or questions? We have a motion and support to receive and file. Please vote. Come on, machine. Okay, 7 will be postponed. 8, correspondence, MSU Extension 2017 Annual Report. We need a motion to receive and file. Motion by Myjack, support by Carabelli. Please vote. Number 9, new business from commissioners. Commissioner Kleinfeld.
Thank you. I was asked a question regarding community development block grant funds that are used for road projects at the local level. As you know, they have a time frame in which they have to do that. Right. And if the road project is tied to this group of folks that are fighting with each other and all the projects are on hold, will they then lose that money to the county? You understand what I'm saying? You know how 696 isn't moving. Some of these local roads aren't moving either. Does that money get lost to the county? And because they have a time frame in which they have to get them done. So this isn't something I'm looking for an answer today, but if we could look into it, what happens if they aren't able to spend the money because they're locked out of the getting the road done? What happens to the money, and will they lose it and lose the project? And is the governor aware of this, and are they doing anything about it? That's just a question I have. If we could maybe look into that. Thank you.
Thank you very much. We will give it a shot. Any other new business? Commissioner Lucido.
My question was actually, had to do with the same thing. Is there something we can do as a board to encourage this to come to an end? We can pray.
Romano might know something about cement.
Through the state, through, resolution, through something, is there something we can do to encourage it to come to an end? Okay, just something we can think about.
Thank you very much, Commissioner. Any other new business? Any public participation? Going once, going twice, going thrice, seeing and hearing none. We have a motion to adjourn by Drollet, support by Leonetti. Please vote. Thank you very much, ladies and gentlemen.